So Dean, abdominoplasty. What does this procedure involve?
So abdominoplasty just really refers to any sort of operation on the belly or abdomen, and some people might refer to it as a tummy tuck. The most common group and the people that get the best results from it are ladies maybe that just finished their family, they've had some stretching of the muscles and the skin after that and just hasn't recovered as much as they would like. Mm-hmm. There's other groups, like patients that have lost a lot of weight, 50 to 100 kilos they may have lost with either weight loss surgery or through diet and exercise.
Is there a misconception between something like liposuction and abdominoplasty?
Yeah, I think there is, and basically abdominoplasty is the most powerful technique for recontouring the muscles, right, and the overall contour. Liposuction has its place, but what that's basically doing is addressing some excess fatty tissue, but it's not addressing either the skin or the muscles to any real degree.
Great. And in terms of the recovery time, do people need to take time off work?
Yeah, generally people in hospital for 1 to 2 nights. They usually go home with their pain under control, although a little bit uncomfortable. Depending on their type of work, they might be back into a desk sort of type job within probably about 2 weeks.
And should a patient expect any sort of scarring around sort of where it's been cut?
There's quite a long scar in abdominoplasty surgery, which is the big trade-off, and that's the thing to consider as compared to something like liposuction. There's a long incision, which essentially goes just above the pubic bone to the both hips, and there's a small incision around the belly button. These scars take quite a while to mature. They mature over probably 12 or 18 months, but as they do that, they really fade quite well to be not very noticeable at all. It's put as low as possible to be hidden under most sort of clothing or bathers, and usually can be hidden quite well by either of those means. Yeah.
Great. So pretty much when they walk out of here, they're pretty satisfied in terms of the results. And
yeah, it's a very good operation from that point of view.
Great. And if they want to get in contact with you about this type of procedure, what's the steps?
Well, the best thing is to have a consultation just to see whether it's the appropriate operation for you and discuss the pros and cons of it. It is an operation that does have Medicare and private insurance rebates, so it's worth getting a referral from your local doctor as well.